It's Wellness Wednesday on the Rickey Smiley Morning Show.
All right, Rickey Smiley Morning Show. It is Wellness Wednesday every Wednesday on the Rickey Smiley Morning Show. We had a one and only Dr. MJ Collier. Thank you for coming back to update everybody from the medical community. Good morning.
Good morning, Rickey Smiley. Thank you so much for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. So June is National Men's Health Month, and so I'm excited about that because this month is all about encouraging the men in your life, including yourself, listeners, care for your bodies by exercising and working to prevent various disease states. So I have 3 recommendations. The first, find a primary care provider to communicate with. Culturally sensitive health care is so important, Rickey. Multiple studies have shown and exhibited that black doctors take black people. You get better health, you get longevity, and you get better health outcomes if you can go to a doctor who looks like you, is aware of your
Dr. Collier,
experiences. Yes.
I need you to say that again, loud and clear, and I don't care who get mad.
You can't get
because
mad.
I believe this, and that's what my parents drive from Birmingham to Douglasville, Georgia, to do a comprehensive exam every year with you.
Yeah, absolutely. So culturally sensitive health care is so important, with multiple studies having shown that black doctors take better care of black people. People that know your cultural experiences, what you like to do, what you like to eat, all types of disease states that are specific or may be different when they present in Africa. They have doctors understands that you just do better. Number 2, Rickey, schedule an appointment for a comprehensive physical exam, as you just stated. That includes men, a prostate exam and a digital rectal exam if you are over 45. The guidelines are 45 for black men. And if you have a relative that has been diagnosed with prostate cancer, if you're 18 years old, you need to be screened. And you continue to be screened because that shows that you are genetically predisposed for that cancer. So, and once you go to the doctor and he evaluates you, accept the potential diagnosis and treatment. That's what's very important. If you go to the doctor and he tells you you have hypertension or high blood pressure and that you're going to need some medications to control it, one, take the medicine and make sure that you're going to be, getting your blood pressure under control. Or diabetes, we got to get your sugar. Everybody says, but I never had, fill in the blank, high blood pressure. I never had diabetes. Of course, you don't until you do. And once you do, it's going to require some treatments. And this may include natural supplements and natural options as well. But most of the time, those are in addition to various types of prescription medications and not instead of medications.
All right.
So,
let's
go to the college, Rickey.
Let's go. Good morning.
Yes, Dr. Carter, good morning. The types of blood pressure medicine you said that for black men are what? You said there were 2, and I'm just trying to find out what 2 were you talking about that we should be taking right now.
Okay, there are multiples, but the 2 most common are a class of drugs called calcium channel blockers. The most common is a drug called amlodipine, and then the others are angiotensin receptor blockers, or ARBs. What they do is block a hormone that makes your blood pressure go up under stress. If that hormone isn't present, it doesn't do anything, which is why it has no side effects unless you're allergic to it. So those are 2 great options that do not affect your ability to get and maintain an erection. So very important. Those are the drugs that I start off with and treat African-American male patients with. There are other options as well, but I'm not going to give you a drug that's going to take away your ability to function as a man. And the treatment of hypertension medication guidelines, the first 2 or 3 drugs that they have will do just that. So if your doctor is following the guidelines and not following you as a man, then you might have some medication. Make sure that you do that. Yes.
Yeah, you need to have as you get older or whatever, you have to have Viagra. But man, we want that thing to be like that little door stopper, that little spring door stopper. And then, because we're going to test it, we're going to see if we can stop a door.
You don't have to have Viagra under normal circumstances. That's not an outcome that is required. But I do highly recommend the Lipo-T.
Right, the absolute Lipo-T.
It's a daily supplement. That will definitely get you where you need to be.
Yes, sir. Darius, you had a question?
Yeah, I was just wondering, since we're on the, sexual medical, when the man gets a Charlie horse, can you, during the intimacy, do you recommend that you go harder or like just get to galloping? I mean, where did Charlie and the horse originate? Because was there a real Charlie? Was there a real horse? And because I know it's a coincidence that I know women be like looking for the horse, and if Charlie comes, do you continue to gallop off up in that thing?
Darius, this is common than you may think. A lot of men will get cramps in Charlie horses doing intercourse.
Yeah.
So I'm gonna do what Maria would recommend: stretch yourself out first, loosen those muscles up, and stretch yourself out afterwards.
Yes.
But very rarely will that stop a man from doing what he's doing.
Yeah,
But I just have to gallop through it.
I just felt that if I get a Charlie horse and she ain't got nothing going on, I typically just try to balance it by pulling her hair. So if I scream, she scream, and if I cry and she cry, and we cry together.
That's very considerate.
Me and my woman, we cry together. Said we cry. All right, let's go to the phone. You're on with Dr. Collier. Good morning.
Hi, my name is Tosh. I'm calling from Dania Beach. You were talking about multiple sclerosis last Wednesday. I have MS for 33 years, been blind for 31 years, back in the wheelchair for 26 years for MS. So what kind of new medicine do they have for multiple sclerosis?
Okay, there's still no cure for multiple sclerosis. But they are disease-modifying drugs, is what they call them. DMT can alter the progression of and improve the symptomatology of. They will not reverse problems that you already have. But again, for people that are in the early or medium stage of diagnosis, we can really make a major in them. But we appreciate the fact that you are surviving with multiple sclerosis. But ask your doctor about some of the new biological treatments that can injectables or infusible drugs. That means you sit there and they run an IV with the medication in you, and that may modify your disease progression.
All right, y'all, Dr. Collier, good morning.
I'm calling because I want to know if I have idiopathic intracranial hypertension, like a elevated pressure in my head. What can I do to reduce my symptoms? It's also called pseudotumor cerebrale.
The term is pseudotumor cerebrale because you feel like and act like you have a brain tumor, but you don't. You just have increased pressure. The problem is that increased pressure can do damage to the brain by basically pressing down on it and destroying brain tissue. And at minimum, it gives you a moderate to severe headache that makes it very difficult to function. So the way you decompress that head, oftentimes people have to have a surgical shunt put in place that drains that extra spinal fluid down out of the brain and it just goes into your body basically, so that you can be decompressed. So that is the primary therapy. There are some medications that can improve the pressure situation as well, but if it's the surgical treatment is the proper therapy. That's what's going to ultimately make a change in your life. And we don't know why that happens. It is a diagnostic dilemma. People get that diagnosis. One, you find out it's good that you don't have a brain tumor,
right.
But two, there are treatment options that are available.
Right.
Yeah. And I know I'm kind of urban, but I had another question, Doc. Like I know a lot of people that live on the beach doing sexual conception can end up with, crabs, that one thing. But the girl in the hood one time I was dating, what can you help with if you get baby roaches? I think it's proximity. Is it? Because I don't think nobody on the beach. I ain't never seen a roach on the beach. But I'm just saying they gotta be somewhere.
So Darius, you make sure you shake those sheets out. If they looking dirty or sort of like they haven't been changed, then you need to go someplace else or just stand up during the act.
Right.
And not have to worry about that.
Right.
Dr. Collier, let everybody know how you can be reached.
These are the opinions of Dr. M.J. Collier, not those of Rickey Smiley or Darius in studio or any other cast members of the Rickey Smiley Morning Show. I can be reached on all social media at ASK Dr. MJ. Go to my website, lifodrops.com, and check out LifeOT. It'll change your life, man. It will change your life. LifeOdrops.com. Okay. Thank you very much, Ricky.
Thank you, Dr. Collier. Them pregnant roaches, Darius.
Just sticking out that tail at the end. That thing at that end, man. That's why every now and then behind the cabinets, I sprinkle a little bit day after peel. Behind that cabinet. To kill them
Don't you
pregnant
dare
roaches.
go away. You listen to Dr. J on the Rickey Smiley Morning Show.